Syahiirah binti Mokhtar. I am 4-year student from School of Physics USM, majoring in medical physics. Now, let us jump into the video. Hi, my name is Syahiirah. Today in this video, I will talk about multiple sclerosis imaging using MRI. What is multiple sclerosis? Multiple sclerosis involves an immune-mediated process in which an abnormal response of the body immune system is directed against the central nervous system. That means the system that is designed to keep your body healthy mistakenly attacks part of your body that are vital to everyday function. Within the CNS, the immune system causes inflammation that damages myelin, which is fatty substance that surrounds and insulates nerve fiber as well as the nerve fiber themselves. What happens when myelin is damaged? When myelin or nerve fibers are damaged or destroyed in multiple sclerosis, messages within the central nervous system are altered or stopped completely, or we call it as demyelination. Damage to areas of the central nervous system may produce a variety of neurological symptoms that will vary among people with multiple sclerosis based on the type and severity. The damaged area develops scar tissue, which gives the disease its name. It causes multiple area of scarring, or we call it as multiple sclerosis. Now, let's recap. Neurons are the structure in the nervous system that allow us to think, see, hear, speak, feel, and eliminate. Each neuron is made up of a cell body and axon, the extension of the cell body that carries message. Most of the axons in the central nervous system are wrapped in myelin, a substance that rich in lipids and protein. Like the coating around an electrical wire, myelin insulates and protects the axon and helps speed nerve transmission. Myelin is present in the central nervous system and peripheral nervous system, but only the central nervous system is affected by multiple sclerosis. How can we diagnose multiple sclerosis? There is no single definitive test that can be diagnosed multiple sclerosis. However, diagnosis is based on symptoms, clinical evaluation, and a series of diagnostic tests to rule other conditions. There are 5 tests that may be done to diagnose multiple sclerosis. The first one using magnetic resonance imaging or MRI. The second one using optical coherence tomography or CT. Third is using spinal tap or lumbar puncture. Fourth is using blood test, and lastly using visual evoked potential or VEP test. In this video, I will explain detail on how multiple sclerosis can be diagnosed using MRI. What is MRI? Magnetic resonance imaging or MRI is a non-invasive imaging technology that produces 3-dimensional anatomical images. It is often used for disease detection, diagnosis, and treatment monitoring. It is based on sophisticated technology that assigns and detect the change in the direction of the rotational axis of protons found in the water that makes up living tissue. And how MRI works? MRI does not use radiation, which make it different from computed tomography, which known as CT scan and conventional X-ray. MRI uses magnetic fields and radio waves to measure the relative water content in tissue, both normal and abnormal tissue. Most of the human body is made up of water molecules, which consist of hydrogen and oxygen atoms. At the center of each hydrogen atom is an even smaller particle called proton. Protons are like tiny magnets and are very sensitive to magnetic fields. When you lie under the powerful scanner magnets, the proton in your body line up in the same direction, in the same way that a magnet can pull the needle of a compass. Short bursts of radio wave are then sent to a certain area of the body, knocking the protons out of alignment. When the radio waves are turned off, the proton realign. This sends out radio signals which are picked up by receivers. These signals provide information about the exact location of the proton in the body. They also help to distinguish between the various types of tissue in the body, because the proton in different types of tissue realign at different speeds and produce distinct signals. In the same way that millions of pixels on a computer screen can create complex pictures, the signal from millions of protons in the body are combined to create a detailed image of the inside of the body. Next, I will explain about the use of MRI in multiple sclerosis diagnosing. Because the layer of myelin that protects nerve cell fibers is fatty, it repels water. In the areas where the myelin has been damaged by multiple sclerosis, the fat is stripped away. With the fat gone, the areas holds more water and shows up on an MRI scan as either bright white spot or a darkened area depending on the type of scan that is used. Now we jump into scanning type. Different scan types provide different information. Various types of MRI scans are used in multiple sclerosis. By using a Fourier transform mathematical method, the computer will process these signals and produce images in the form of single incision or single slice, either in sagittal, coronal, and axial plane or in 3 dimensions. Image A shows MRI of the brain in sagittal plane. Image B shows MRI of the brain in coronal plane. Image C shows MRI brain in axial plane, and image D shows 3-dimension image. Sometimes gadolinium, a contrast agent, is injected into the vein during an MRI to help detect areas of new inflammation. Because gadolinium is a large molecule, it normally cannot pass through the blood-brain barrier, which is the specialized cells in the blood vessel wall around the brain and spinal cord that prevent substance from passing from the bloodstream into the central nervous system. However, when there is active inflammation, the blood-brain barrier is disrupted and gadolinium can enter and highlight the inflamed areas. Common MRI sequence used in multiple sclerosis include: first one, T1 weighted without gadolinium that may show dark areas or hyperintensities that are thought to indicate areas of permanent nerve damage. Next is T1 weighted with gadolinium that may show bright areas or enhancing lesions that indicate areas of active inflammation. Third one is T2 weighted that show overall disease burden or lesion load, meaning that it shows the total number of lesions both old and new. Lastly is fluid attenuated inversion recovery or FLAIR that shows multiple sclerosis activity by reducing interference from the spinal fluid. This picture shows MR image of a patient with multiple sclerosis. Image A is the pre-gadolinium enhanced T2 weighted images that show multiple periventricular multiple sclerosis lesions. Image B is pre-gadolinium enhanced T1 weighted images that show hypointensity of some of the multiple sclerosis lesions. Image C is gadolinium enhanced T1 weighted images that show several lesions enhanced in focal and ring light patterns. Image D is UPSIO enhanced T1 weighted images that show different pattern of enhancement. The main cause of hazard in MRI is its very strong magnetic field that is able to attract metal or ferromagnetic objects such as paper clips and credit cards. The magnetic field is always there even when there is no scanning being performed. This has been the most important basic safety criteria that must be taken into account and was included in every procedure before, during, or after the MRI examination.